Becky, for many years you have served as the on-the-ground resource after disasters here in Tennessee and throughout the South and indeed around the globe. Are there some lessons learned that you're applying here during the COVID crisis from all the experiences that you've had in the past?
I think we are. I think, the experience we've been able to have at Centerstone as an organization, I almost feel like has led us up to this point. It's given us the intelligence and the knowledge that we needed to know how to navigate this. Um, so I think we see, during times of disaster, people tend to be very operational, which is what I think we're seeing now. The difference in this event is it's so long term. I think the longest, we had seen locally would have been the floods in 2010, which did go on for a bit. It wasn't like a tornado that hits and moves on and you clean up for over a few days and then you see how people are doing. I think what we've seen with this one is we're still in the middle of it or whatever phase we are of this, and it's not over. So people tend to hunker down and try to survive as best they can. And for different people, that looks different. So I think it's upon us, during the event to help the people that need help with their mental health wellness, and also at the same time planning for what that's going to look like when this does ease down and we get back to whatever the new normal looks like. It's
Yeah,
just new.
let's talk a little bit about that. We got
Yeah.
right now, as we speak, for the most part, people are sheltering at home. They're staying close to their residences. They're not going to work for the most part unless they are some of the fortunate ones who can work constructively from home. But that leaves out a lot of vulnerable people. And we have
Right.
probably more than 90% across the country of people staying under some sort of stay-at-home order, staying at home, physical distancing in place. So clearly, this sort of situation, which is unprecedented in the country and really in the world in a global sense, the situation is having an impact on our mental state, on our state of mind. And you mentioned the word new normal. Um, all of this puts folks at a particular risk for anxiety, and I would think depression and poor
Right.
mental health in the larger sense. What are you actually seeing being on the front line there at Centerstone?
Yeah, I think we have, individuals who live with chronic and persistent mental illnesses, and some people do fairly well during these events. Surprisingly, we've seen that folks who have a serious and persistent mental illness sometimes do pretty well in these events and rise in terms of their functionality. Some people not so much, and you see some decompensation, and you make sure we have systems in place to treat those folks. We also have people we were seeing during the beginnings of this who don't have that kind of a condition, but they had a situational condition and, depression, anxiety for whatever reason, they're going through divorce or things like that, trying to make sure we can take care of them. And then I think, seeing people that are having issues because of this event. I'm on a call weekly with a lot of national organizations that are in this mental health and suicide prevention space, along with some other providers. And I think what we're seeing now is not an increase yet in the calls like to the National Suicide Prevention Lifeline, for example. We haven't seen really an increase in calls in our crisis call center. But the disaster distress line, has, I think, seen a 500 or 600% increase in calls. But they only took about 50 calls a day. So you have to keep that one in perspective. Text and chat lines are seeing an increase in calls. The crisis text line, in their communications, is seeing that. The Trevor Project, which serves LGBTQ youth, is seeing a real uptick in theirs. So I don't think the tea leaves have smoothed out yet enough to see what the after effect's going to be. But for sure, currently, I don't think we're seeing a huge uptick in people having a difficult time.
You mentioned that what is unique about this pandemic is that it is going to go on for a long period of time. It's not, as you mentioned, like a tornado coming through or a hurricane coming through that has an assault and then we can have a recovery
Right.
and remediation. That this is likely going to go on in some shape or form for a year or a year and a half. The opening up, the beginning to opening up that we'll see over the ensuing weeks and months. But then as the disease comes back and people come into the hospital and the spread continues, we're gonna have to shut it back down. And it's gonna be like an accordion, opening and closing, opening and closing.
Right.
Is there any way to predict what impact that will have on people's mental health?
I think it's not going to be good. That sense of uncertainty, it's almost like one of those bridges you walk across that kind of go like this, and
Yeah,
some people won't even get on it because they're afraid of heights, or
right.
you feel very unstable, and so I think that uncertainty is going to be damaging to individuals, and that's probably across the age spectrum.
Yeah,
It's going to be tough for elementary school children to have that push and pull, that accordion, as you described. I have a 21-year-old here at the house who's a junior at nursing school at Belmont until Monday, and then she'll be a senior. But it's been very stressful. Nursing school, who would have thought you could do that online?
yeah,
So the
yeah,
uncertainty of what the fall's going to look like for college students, and then, people starting families. I have a niece that had a baby on Friday. That was very different. And, people that are my age and older, and I just think that kind of rocky uncertainty is going to require mindfulness to one's mental health
yeah,
and ease of access to service if you need it, just like
yeah.
a medical condition might be.
Yeah. Unlike all the other disasters that we talked about that hit a geography or a specific group of people, this whole COVID-19 crisis is touching everybody. Everybody. It doesn't
Right.
distinguish between rich or poor or black or white or young or old. How do behavioral health providers manage this degree of diversity and total reach of an entire population?
Well, you have to prepare them. It's really interesting to me the things that you can do and we can do when we never thought we could have done that. So we're a large organization, across a multi-state footprint with multiple thousands of clinicians. And to think that Centerstone could have moved about 3,500 frontline direct care providers to their homes to provide care virtually in less than a week. I would have told you in February that you were talking out of your head,
Yeah,
because who would have thought we could have done that? We're a large, large, large ship in the ocean. And to
yeah,
be nimble
yeah,
is just not something that you think organizations that large, and some of our other folks around the country, that you couldn't do it.
yeah,
But
yeah,
when you can do it, you do it. So to get those folks virtually at home, that's, it was but then just what you said, we now, it's upon us as an employer to make sure that those folks are competent, confident, and skilled in all of the areas they need to be skilled in. And so being able to use the bandwidth that we have in our research institute to figure out what those buckets of training are and train them. So whether it's, hey, we may see increases in domestic violence. Here's some things that you might want to be cognizant of now that we're doing virtual things with a case that could be a domestic violence situation. So it's upon us, and we have to take ownership responsibility to get them ready to work with any population and every population, and to be able to do that comfortably and safely and effectively.
You mentioned your child, and we've all seen these humorous videos and comments and floating around of a mom or a dad working at the computer with a child or two or three or sometimes four
Right.
in the room, running around on their knee, trying to focus. And although these
Yeah.
are funny, and we can
Right.
all relate to that in some shape or form, there are huge pressures for the parents who are trying to be, probably do their jobs, be reliable employees, and have work responsibilities. At the same time, be teachers. How can employers be supportive of the team members who are juggling all of these challenges right now?
To me, the first thing we have to do is give people some grace.
Yeah,
And I called I don't, I had a lot of travel scheduled during this time and I had to cancel things and trying to get, refunds and things like that. And one of the companies I called the other day, in their opening message before you got to an operator, said, hey, for the safety of our staff, we moved everyone virtually and our staff are trying to take care of you. They're working at home. But if you hear a dog barking in the background or a small kid, we apologize. Like, cut us a little bit of slack.
yeah,
We're not. So I think it's another piece of that being new normal. So
yeah,
somebody's kid's sitting on their lap, that's cool. Now I get to see your kid, and I don't just hear their name, but maybe I know what they look like, and things like that. So I think giving people grace is the first piece, but you'd obviously have to go beyond that. And I think making sure that we are providing opportunity for them to be well also. We are constantly trying to send things out in our intranet about wellness and tips and trying to take care of them and making sure they're okay and that they're able to balance this new landscape of work life, which is just so different in this. So I think you have to be purposeful about it and you have to be active about it and
yeah,
offer them times even to get together once a week where they can just vent about the wins. Not all of this has been negative. Being able to do things now in person, virtually, or telephonically opened up two new channels of engagement for folks.
yeah,
We're in a beta test that we could never have prayed harder for, and we're in it now.
yeah.
So having these alternate means of communication is a wonderful thing. And so we are getting to engage with folks that normally maybe wouldn't come in once a week.
Yeah.
So I think it's upon us to make sure that the staff feel ready and competent.
Yeah, and another population besides those who are at home trying to work are the essential workers who are actually getting up every day and going to work and working on our behalf, and that's why they're called essential. And
Right.
you think of whether it's the healthcare providers who are going to the clinics and the hospitals to serve our physical and mental needs, whether it is the grocery store clerks who are there serving each of us in a controlled environment, but one that is not totally controlled, of people who are doing the deliveries that we are all partaking of in some way, whether it's food or groceries and or supplies that we need. Is there anything in particular for those essential workers that either Centerstone is doing or advising as we go forward?
Yeah, it's funny you asked that. I'm going to do a webinar next week for the CDC's EMS branch, and it is exactly what you talked about. I think the first thing we have to do, and I don't really know that we've fully been blatant in the way they need to, is to understand, as I talked about earlier, we're still in operations. And so these folks, just like if we were responding to rising floodwaters, they are still in operation mode. And so, in my experience, they're not to the place yet where they're going to not compartmentalize this and they're going to let all their emotions out.
Yeah,
They're not.
yeah,
They need to. I mean, you working in hospitals, in your lifetime, that compartmentalizing and making sure that you can get back up and go do the job you have to do. So we have to approach them in that way. and we have to give them the tools they need, just like this were a hurricane, a wildfire, a flooding, and that's supportive things. And so we educate them on the signs and symptoms, the things they can, the little small things they can do while they still are operational, and some of them sound cliche, but they're needed. Sleep, nutrition, hydration, support as much as they can, and I think little opportunities to let a little bit of that steam out of the cooker is a good thing. And then we'll be ready for them to do, I think, the really hard work that will
Yeah.
need to come later in terms of providing them, some debriefing opportunities, and that'll offer the opportunity for assessment, because I'm sure we're not going to come out of this without some of our frontline staff being heavily negatively impacted by this, probably including, some post-traumatic stress in some folks.
Yeah. Is the reverberations? I mean, this is deep. It's unprecedented. It's a crisis that we are all having to be nimble and adjust to and learn each day and dismiss the things that aren't working and grabbing the things that are working. In a more sort of deeper sense, what sort of reverberations will our communities be feeling in the days and weeks ahead?
I think, probably the two biggest are apprehension, which causes anxiety, which can cause depression. Some people will cope in ways that aren't healthy for them. So I think, seeing alcohol and substance use, we were already in the middle of a very bad opioid situation.
Hmm.
So I think we're going to see those things in individuals who normally don't experience that. And if you haven't experienced that, it's frightening. So, we also know that if you haven't experienced that, you probably don't know where to turn to get that treated.
Hmm.
Normally, what we see is when someone has a new symptom arising, they go to the emergency department. When we see 80% of the crisis calls that we do face to face are in emergency departments. Well, that's not a really um, inviting place to go right now if you're anxious or depressed. So I think on the public health system, it's just going to be imperative for these feelings that are going to come that you're talking about, that people know how to access service, because if they don't go to the emergency room and they don't really know what to do, I think it's going to leave a lot of people in peril, and we don't need that. We need people to know how to access, especially now that you can do things in a televideo or a telephonic way with providers. We're going to have to
Yeah.
make sure people know how to do that.
Yeah. Is the telehealth and the virtual health and the communications is clearly one of the silver linings as we look for those silver linings and the positive things that we can take forward, that we're learning each and every day. And anything else that you can think of that would be useful to at least underscore in terms of what we're learning that's positive, that's constructive, that we'll be able to apply in the future?
Yeah, I think besides, this silver lining of, I think delivery of care is going to look different after this is over. I think providers, people that accredit and license and allow you to operate are going to look at this. Payers are going to look at this, and we'll have to siphon through and see what worked and what didn't, or what could work. But beyond that, any disaster I've ever been a part of, the thousands I've gotten to respond to, if you squeeze it hard enough, I think small nuggets of goodness come out, and I think we'll see that in this. And some of that, I think, is connection. Now you have to be very purposeful if you want to stay connected with individuals. I started I just finished a couple of days ago going through the alphabet. So early on, I set on my schedule every day to look at my phone. I started with the letter A in my contacts, and I just looked at all the people that were in the A, and I reached out to people in a text or an email. Hey, how are you doing? You hunkered down? And this was people all over the country, the world, in Tennessee. And I did a letter a day. and I just got done, so I'm going to cycle back to 8. It gave me some purpose early on when you're feeling a little discombobulated. And I reached out to people I haven't talked to in years or a decade that I really am fond of. I just was too busy. So I have a lot of lunches when this is all over. We're going to connect or things like that. So I think that's a good thing. I know I've had colleagues that are doing happy hours, virtual happy hours with people they haven't talked to in a long time. A colleague of mine went to a virtual costume party last weekend. So I think we're having to be creative in ways to stay connected with each other, and hopefully that sticks and we do come out of this in a more connected way. The other thing I think the goodness is going to come out of this is we're seeing how things that we never thought possible are possible. And if we have to, we can make things work and make things, whether that's moving to working from home. Who would have thought Saturday Night Live could be produced and on our televisions last weekend with all the people being from their houses, or a massive concert where you get to see Elton John playing the piano and singing with a basketball goal for his kids in the background. So I think we're much more nimble and resilient and innovative than maybe we thought we were, and we've tapped into that stuff, and hopefully we've opened that box up and we can keep it open and harness that, especially as you talked about over until we can even get a vaccine for this. We can do this. It's not fun. It's not comfortable. My daughter said she'd give up something really good to go walk around TJ Maxx, just to walk around and be out. But when we have to hunker down, we can, and it'll be okay, and we'll come out of the other side.
Yeah, I think that those points are so powerful. Just with this past week being our sort of global world nature week, sort of officially, people are thinking a lot about nature and going out and spending time in nature and listening and watching, and whether it's listening to the birds or watching the spring flowers or smelling those flowers or walking along a stream. I think this appreciation of the world around us as well, which has a real health and mental connection,
I agree.
if we pay attention to these good things. Let me just close and ask you, when you made those phone calls, as you went through the alphabet, what did you learn from it, just personally, and the people you haven't talked from, and all of us say, well, gosh, I wish I'd been making these calls earlier, but how has it affected you?
I felt like it was some people that I'm not super close with, but I thought, yeah, he moved up and now he's a medical director for this blah blah at Yale. Like, that's kind of cool. So it just made me feel more connected to my community. I saw that I had the time to do it. When I'm not working or trying to exercise or reading. I haven't really watched a lot of television. I didn't see Tiger King that everybody's all whipped up about. Now the Michael Jackson documentary, I hear that's a big thing. I haven't done, I just have been busy. But it made me feel like it was going to be okay and that I had a really good support system. And it showed me that, you know what, if I was having a hard day or needed something, I've got a pretty big tribe. And I think if people are purposeful about it, they'll see they have pretty big tribes too. And if they don't, we'll help them get one. But it really, from a humanity way, it was a good exercise for me.
Yeah, yeah. Well, Becky, thank you so much for being with us today, and appreciate
Absolutely.
that all you do on the front line there at Centerstone, as Centerstone serves so many people around the South and the Midwest and the country at large, really on the front line. We're in all this for the long haul, and our conversation today has just helped me as I think about where we are today and where we will be in the future. But thank you for everything that you're doing.